And so far mine doesn't have it. What kind of dog is this? It's a what? Wrong.
American Bulldog.
That's an American what? This is an American Bulldog. Okay. What's the difference between an American Bulldog and a boxer?
That's a boxer.
It's mainly the distribution. Both of them are brachiocephalic breeds, but the distribution of the muscle mass. Boxers tend to be fairly short, and they do have some heavy muscling in the foreend, but they don't really have a whole lot in the hind end. American Bulldogs have much longer legs, and they have heavy muscling in both the forelimbs and the hind legs. But both of them have this kind of head, like all brachiocephalic breeds would have. So what's the Boston Terrier look like?
Up this
It looks like a miniature boxer. And usually, what color are they? Black.
No, look, it says
The American Bulldogs are usually brown and white, but they can be black as well. Okay, so they have a condition that's called subaortic stenosis, and what that means is there's a disturbance of the outflow tract where there's a layer of connective tissue that may be mineralized, and usually it is, right under the aortic valve. It's an aortic outflow tract. It's kind of hard to see that, but if we look at this one, where's the aorta? Got any idea? Right there. And that's the interventricular septum. Look at it again, interventricular septum. So what were you talking about? Right here. That's the interventricular septum. That's the free wall of the left ventricle. That's the aorta. The aortic outflow tract is really right in there, right underneath the aortic valve. The aortic valve will be coming right across here. So the subaortic stenosis really is occurring in this area. Normally speaking, this would be a little wider than this here for the blood to flow out. And when you get ejection occurring, this is just showing the flow. What happens? Well, you get some backflow also. You get forward flow that's restricted and backflow. Why is this thing? Come back and look at. Well, you have to look at this one to get the idea better. What's happening with this valve? It would be stenotic, and you'd have some impediment to flow out. But what would also happen once the blood goes past it? If this thing can't open well, what can it do? It can't close very well either. So you have blood going both directions, really. But most of it is from the shutdown from the forward flow. And that's just showing hypertrophied and hard. And the x-ray showed the same thing. The problem really occurs right in here, right under the valve leaflets. And as we look over here in actual specimen, like right there, we better look right there, and right here in this one. By the way, where did this one come from? Anybody got any idea where this picture came from? What's that say right there? Cornell. So what comes from Cornell that you know about?
Your wife.
Now he would say that. Why does he say that? He said that because he knows I can't do anything back to him. Yeah, she comes from Cornell, but there was also another person at Cornell named John King that put together a set of gross and microscopic images, which you have as a reference. And what is that reference? Necropsy what? Necropsy show and tell, which tells me you guys haven't been looking at it. Well, how come you didn't know what it was then? And half of the pictures that come from there, you see that little tag. And there's another thing that tips you off to that too. If you see a specimen on the necropsy floor, and the floor is made up of red tile, you know, that necropsy floor at Cornell is red tile. They changed the building over and renovated and all kinds of stuff, but that red tile floor stays there. So Or if they take it out, they put another red tile floor there. So that's very characteristic also of these. Now, what's this one show that the others don't show so well? How thick is the wall? Very. Okay. That just demonstrates the hypertrophy. And you don't call it hypotrophy, you call it hypertrophy, right?
I see where you're going this.
You saw who I looked at when I said that. Okay, here's a mineralization that's also dystrophic due to tissue injury. This is in the liver of a horse, and there's the calcium there accumulating. And this is in the sheep, showing it again. What do you think these things are due to in the liver? They usually do to parasite migration. That's what causes the damage. And a horse, what would you think, first of all? What migrates through the liver? Strongyles. Okay, here's a dog, and this dog is from Texas. Texas has got some good stuff, got some bad stuff. This is some of the bad stuff. Here are parasites that are responsible for this. You can see one there, and you see this too. When you see this pigment, what kind of parasite do you think about? When you talk about helminth parasites, there are three basic types. What are they? Nematodes, cestodes, and trematodes. Now, what are the nematodes? They are the round worms, okay? What about cestodes? Flat worms. Tapeworms. Sorry, tapeworms. Cestodes are tapeworms. They're flat too, but they're tapeworms. And the trematodes are what? They are flatworms too, but they're called what? Flukes. Okay? So flukes usually have parasite pigment associated with them. So these things are flukes, and actually the particular fluke that causes this is Heterobilharzia americana. Yeah. Anyway, as it's migrating around, it causes damage to tissue and mineralization. And the arrows are pointing to some paler areas, very dense areas that are the mineral. And here's mineralization that's occurring in the skin. This is in a human, and it can happen also around joints and things like that. That's what that's for. But this is scleroderma, and in that case, there's an autoimmune kind of reaction in the skin that results in mineralization, and that's what those kinds of areas. That's the mineralization from damage to the skin. You get scarring of the skin and mineral deposits in it. And as we look at it histologically, that's what the mineral looks like. Why do you think those little white lines are in there? What happened there? Is calcium hard or soft? Hard. So when the knife goes through the tissue, might it bounce a little bit as it's hitting these harder areas? Yeah. So we refer to them as chatter marks, but that's what that is. These are little microfraction marks from the knife going through the tissue that is mineralized. So why do you think I have this picture here along with this?
Does it happen in the pregnant woman?
Because it's usually associated with pregnancy. Okay, here's a dog that also has skin damage, and all of these plaques on the skin contain mineralized areas, and there's a nice mineral there. See that purple thing down there? That's the calcium, in addition to some inflammatory cells around it. This is the same thing, but it's just a much lower magnification, what this is here is a higher magnification of that. That's higher magnification of that area. So you can actually see the cells and the mineral. And this is a similar kind of situation, but this is called circumscripted. Why do you think they call it that? Look at this, and go back and look at that. Why do you think they call this one circumscripted?
It's contained.
Because it's a very localized area. It's also an area of damage, and it's got mineral in it too. That's the area, and if you cut it open, you see the mineral accumulating in an area like that. That's what it looks like with an X-ray. And this is the histologic. The mineral would be the more purple areas in here like that. Like that. Okay, metastatic calcification. This is when you have an increased blood level of calcium, and that can be due to a number of things, many of which are neoplastic, and we will talk about some of this as we go on. This is just basic vitamin D metabolism, and you should be familiar with this. Where's the most active form of vitamin D produced? Liver or kidney? It's in the kidney. That's where the most active form is produced. And what does that cause? Well, that interacts with the calcium pool, and what you're trying to do is maintain an adequate blood level of calcium. This is completely normal, showing you what happens with vitamin D. But if I damage the kidney, how does that affect that? Now, you've seen this slide before when we were talking about cellular adaptation. What's that right there? What's that pointing to? Parathyroid, and is it normal size or is it big? Big. So that's that parathyroid hyperplasia. Now, why is that hypoplastic? Because you have a damaged kidney. In the kidney, when it's damaged like that, why is phosphorus increased in the blood? Because the kidney can't do what? Excrete it. And why is that? That's related to the barrier. And what is the barrier? What's the charge on the barrier? It's a positive charge. So, oh, wait a minute. It's a negative charge. Okay. So, what's the charge on the phosphate? It's negative. So it repels the phosphorus, so it can't excrete the phosphorus. That's why the blood level increases. Now, what does that cause? When you have all of this phosphorus floating around in the blood instead of it going out in the kidney and the urine like it ought to, it's going to combine with calcium, okay, in the blood. Now, what does the body need to function? Bound up calcium like that or ionized calcium? Ionized calcium. So now what happens? When I'm binding up a lot of my calcium that would normally be circulating to do what it's supposed to do, for instance, like activating insulin sites and all that kind of stuff. Well, if that doesn't happen, then parathyroid is going to come into play. And what's the parathyroid going to do? It's going to pull calcium out of bones, and that is what will cause the hypercalcemia. Now, the parathyroid activation to try and normalize this situation is what causes this. That's why you get the hypoplastic parathyroid. So where does this extra calcium go? Well, it goes into areas where there is usually a low pH. So, why I have a picture of the stomach up here? What's the pH of the stomach? High or low? Low. So this mineral will precipitate in the stomach. That's it, in the gastric mucosa. This is one that's showing it. What's happened here is the stomach is not open yet. And this kind of wrinkling that's occurring here is actually the effect of the mineral, and if you felt that, it would be very firm. And it's time for you guys to take a break. I went a little bit over, and why did I go over? Because you were up here for a while, you know, before. So it's actually 5 after. So take a break for 10 minutes, and then we'll come back and do the rest of it.